Welcome to COIQ, where you learn how health innovators maximize their success. I'm your host, Dr. Roxy, founder of Legacy DNA and international best-selling author of How Health Innovators Maximize Market Success. Through candid conversations with health innovators, early adopters, and influencers, you'll learn how to bring your innovation from idea to startup to market domination. And now, let's jump into the latest episode of COIQ. Welcome back, COIQ listeners. On today's episode, we have Adeel Malik with us. He's the CEO of Clearstep. Welcome to the show.
Thank you. Happy to be here.
Yeah. So Adeel, if you don't mind, if we just get started, for our listeners who aren't familiar with you or the work that you're doing, give us a little bit about your background and what you're doing with Clearstep.
Sure. What we're doing with Clearstep is we are, and to put it very briefly, trying to bring the consumer experience from every other industry to the experience of accessing healthcare, making it really easy for people to understand what care they need, who exactly they should go to, who's in network, how much things might cost, and when they can go, being able to access virtual care easily or being able to access online scheduling easily. So really, consumerizing that experience, making it really easy to have all the data and information you need to make an informed decision, same way you do when you shop for a car, you book an airline ticket. Obviously, there's a lot more nuance in healthcare, but it's really that experience that we're trying to bring to the fold. And to my experience is coming from, healthcare consulting that I did for a number of years, and then before that, medical research at Johns Hopkins.
That's great. That's great. So, what's interesting is we were supposed to meet at HIMSS just a few weeks ago. And of course, that didn't happen. And the conversation that we would have had a couple of weeks ago is going to be very different than we were going to talk about today. It's kind of like in the midst of the COVID chaos, right? So you have some exciting news. What's new?
Just found out we were featured on the front page of TechCrunch this morning. So super exciting. I've been in meetings since the morning, so I haven't even been able to read the article yet, but really exciting news for us. And we're happy to, being a care routing solution at our core, it's kind of made a lot of sense for us to prop up an extension of our core product that's specific to COVID and help make sure that people who are anxious or truly at risk know exactly what their next step should be.
That's incredible. Congratulations. I think that
Thank you.
That is just absolutely wonderful. And that's part of what I want to talk about today as, health innovators like yourself are faced with all of the changes that have resulted from the COVID crisis. I feel really strongly that for many, if not all businesses, we're at this crossroad of pivoting and deciding that we don't have a solution now that meets an unmet need or priority that's relevant right now, like that, that previous business model is not going to work, or like what you just mentioned, that it does and it works really well. We have an opportunity to reframe our business around the new unmet need right now. So let's talk about that a little bit.
I'm not sure it's about reframing for us entirely. I think it's almost doubling down on what, and this is specific to us, right? Being, again, care routing. Now, there is somewhat of a reframing because it's not, we aren't shipping Clearstep as it is, as the whole product. We're shipping kind of this extension of it that's specific for COVID. But at the same time, it's underscoring the same value prop that we were driving forward anyways, which is that right now in general in healthcare, there's a lot of confusion that results in a lot of wasted spend and a lot of inefficiencies and missed opportunities to deliver the right care at the right time because people just don't know what to do. They don't know whether they should go to the ER or use telemedicine or go to a minute clinic or use, go to an urgent care, and they don't know which one's in network, and they don't know how much things are going to cost, and they don't know when they can go, right? So that's the same problem that we're experiencing right now. It's just dramatically exacerbated because of what is kind of projected to be the case, in U.S. healthcare, where we won't have enough resources to meet the demand of people that may need to be hospitalized. And it's really horrible. It's really dramatic. It's really sad. But this is where we're hoping to play a very small part in just making sure that in that context where we may not even have enough beds to service the people that will need it, that people who really don't need to go to the hospital are not going to the hospital. Even people who don't need to use virtual care and just need to self-isolate and stay at home, that's what they're doing. They're not taking up kind of necessary bandwidth with Doctor on Demand and Teladoc and MD Live and these other telemedicine companies that are to their neck and work. So, getting people to the right point of care. And then on the counter side, people who do need to go in, people who really should go in and shouldn't just stay at home and self-isolate, but now it's time. They need to get specific instructions on how to safely get to the ER, but they need to go. That also needs to happen, right? So, it's the same function of what we're doing with our core product. It's just now there's such an important use case for it in the very, very immediate term.
So I think that's really important to point out, that I think that our listeners have what I would call, I refer to it as and it's not to say that they need to pivot at each one of these areas, but it's something to confront. Do I need to pivot my business model? Do I need to pivot my marketing? Do I need to pivot my sales? Right. And so I think the example that you just gave is you don't need to pivot your business model. It's still very valid in the midst of COVID. What I hear you saying is the messaging's changing, right? So a month ago, you wouldn't have had COVID on your website. You wouldn't have had COVID in your elevator pitch. And now it makes it more, tweaking that messaging allows it to be more timely and relevant, and eliminating any guesswork of how your solution could fit the need that people are experiencing right now.
Yeah. I think that's a really fair way to put it. And, I'm not sure how this will apply to other digital health companies, right? We just, got lucky. I don't know what the word is, in that we're actually positioned to, with the technology we already have, do something that's so directly relevant. I do agree, though, with your kind of previous comment or observation that now is a good time to try to take a step back and try to think. It's what we're trying to do, too. Think really hard about what's the world going to be like in 6 to 8 weeks and beyond, and how will we need to change as a result of that. We're not immune to that either, right? So we're trying to think really hard about, and it's hard because we're just all in the weeds every day with COVID, but we're trying to sometimes take a step back and think about how do we strategize 2 or 3 months from now to kind of come out of this, whether that's repositioned or doubled down, or how is our messaging going to change, and how are we going to go after our target market? All those same questions, right? So I do think now it's an important time for everyone to take a step back and try to think about that, because it is likely the case that things won't be the same in terms of how healthcare is delivered.
So it's interesting. So for someone like you, the solution that you're bringing to market is where you described earlier, where it's really bringing a highly digital, consumer-centric experience to the healthcare industry. So I imagine for you, being able to work virtual is not a stretch. Probably being able to conduct business meetings via Zoom, right, is not a stretch. But for some of these healthcare organizations, for some of these entrepreneurs, they were really just boots on the ground that were knocking on doors. And is completely different skill set. So their business model might still be intact. Even maybe some of their marketing might still be intact. But talk about an immediate sales pivot, because, those doors are closed. Two, you can't fly to reach them. And in a lot of instances, they're just overwhelmed and inundated with putting out the fires of the day that they don't really want to hear about the solution that you have. So like, let's just kind of talk about what you're doing in that regards, and how that may be the same or different as far as getting in front of the folks that would be your customers.
So it's interesting, and I have a lot of sympathy for startups that are kind of going through, and all businesses, small businesses that are, it's hard times, and it's really tough. I of course don't have answers as to how to approach and even navigate it. I mean, for us, we are again kind of lucky, but you know, the same stakeholders that we typically sell to, now what we can offer them is like number one or number two on their priority list.
Right.
And so, you know, we went through a 8-day sales cycle last week with a major health system.
That is absolutely history in the making.
Yeah, I mean, it's unreal, right? From the point of picking up the phone and them asking, hey, can you do this? And us being like, hey, we're already working on it. It's like 2 days away from being ready, but starting a contracting process, getting things signed, getting things configured and customized and implemented and live for users to use in literally like 8 days. Right. I mean, yeah, absolute record speeds because of what we were talking about. It's a problem. Health systems need to make sure that people are getting the right level of care and not coming in, or they are coming in when they really do need to. So for us, our stakeholders have an acute attention on what we can offer right now.
So one of the things that you said that I think is really interesting is it almost sounded like you said they reached out to you.
Yeah. So this was somewhat of a unique situation.
Interesting too, right?
Yeah. So we were already in communication with this group, which is why, and they knew what our core solution was. So their immediate question was, hey, can you do this as well? Yep. And we've had that happen, you know, 2 more times as well. And we're trying to, you know, it is true. We're trying to do a bit more proactive outreach, which is harder because now even we actually, maybe this is relevant to your point before, even we, with a solution that is relevant, maybe feel like to people who are just kind of putting out fires, like they don't want to think about something new. When there's an existing relationship where we were already engaged in conversations with them and they kind of had us filed away in their head, now we can kind of be surfaced back up to the top. But making the initial touch point is actually still very difficult for us right now.
Okay.
Versus just talking to people we've already been engaged with.
Hey, it's Dr. Roxy here with a quick break from the conversation. Do you want your innovation to succeed, to change lives, to shape the future of healthcare? I want that for every health innovator, which is why I invented COIQ, an evidence-based framework to take your innovation from an idea to startup to full market adoption. If you're not sure where you are in the commercialization process, take the free assessment now at drroxy.com/score. Don't miss out on impacting more lives just because you have a low COIQ score. The free assessment is at drroxy.com/score. That's drroxie.com/SCORE. And now let's jump back into the conversation.
So I can see that would play out as well, that, you know, I've got some contacts in our database where we're nurturing them, we're trying to get in front of them, we've maybe done some demos or some presentations, you know, it's still, you know, competing with all the other priorities. And then like you said, priorities change, and now all of a sudden the door opens wide quickly. So what are some other strategies that And it's okay if you don't have it all figured out, because all of us are just trying to figure this out in mealtime. Even myself, so we as an organization, when I was supposed to speak at HIMSS at a couple of sessions, and so when the conference was canceled, we had an understanding of the situation to be one thing. And I said, okay, well, let's just take that material and go virtual. And then we started to develop the virtual experience of that. And then basically all hell broke loose. And so like that, even that material just wasn't even going to be relevant anymore. And so we've pivoted, we've shifted twice just in the last 2 weeks, because it's such a dynamic, evolving situation. So anyway, so I think that we're all trying to figure this out. And so, what are some strategies and tactics that you are deploying or considering right now in the new normal that we're living with?
Yeah, I mean, I don't know if this is directly related to the question, because I think the direct answer to the question is like, we didn't even have that much time to strategize. We just started building this extension, and then we were getting demand, and then we were like in implementation phase, right? Even taking a step back to like strategize has been a little difficult, but in the moments where we do, like what we're trying to think about is, how can we make sure that that Clearstep being implemented in this way, specific for COVID, still grows to the broader use case, right? Beyond. So right now, we are just focusing the implementations on the COVID screener and making sure that we're doing very robust triage for people concerned about COVID. But obviously the direction is, well, now let's just enable Clearstep, which can handle any symptom that comes, that a patient presents with, and get them routed to the best resource within your healthcare ecosystem. So that's how we're trying to set up our infrastructure with these relationships, with these quick deployments, so that in 2 or 3 months, hopefully when we're on the other side of this, it just makes a lot of sense to say, well, this went super well. This underscored the need and highlighted why this kind of technology is really important. So all you have to do is flip the switch, and we just enable more functionality within our existing contract and within our existing relationship. It's like we don't even have to go back to legal paperwork. We already went through that. Just flip the switch, and we can employ the more robust use case. So that's what we're trying to think about.
And I think that makes a lot of sense. And I think that's definitely, wisdom for our listeners to take heed to, is that it would be really easy for us to think about just the immediate business opportunity and not think about the longer term commercialization of the full solution, if it's still relevant, right? But planning for that to be part of the process from the very beginning, so that way you can eliminate any work. Like you said, we don't have to go through contracting. We don't have to go through a really quick 8-day sales cycle only to get through this, to then go back to another 12-month sales cycle at the end of it.
Yeah, exactly.
Oh, yeah. So I think that digital health innovators have a lot of changes to face. There's a lot of challenges that are taking place, but I think that you are an incredible an incredible example of the opportunities that are peppered into this crisis that we are facing. And, how do you think that this is going to transform adoption of digital health and connected health and all of the innovations that we have been trying so hard for several years now to penetrate in the healthcare industry? What's your perspective on how this might change that going forward?
Yeah, it's a good question, one that's, I think, on everyone's mind. And for everyone, it's pure speculation at this point, right? But, it seems like let's use telemedicine as an example. Historically, before 2 weeks ago or 3 weeks ago, telemedicine was still struggling with just low utilization, low adoption. And the big thing for telemedicine companies was, despite the fact that, we're offering a clearly more convenient, cheaper, consumer-centric and friendly way to access care that is actually just as often just as clinically relevant as going in to see a provider, people are reluctant and hesitant to give it a try, and to just try using it. And largely because of that, the question around that last piece, is this as clinically relevant as going in and seeing my provider? Can I get what I need out of this?
Yeah.
And now there's just been a 2 to 3x surge, potentially more, in daily telemedicine utilization. And perhaps what people are thinking is now this is going to change the paradigm of consumer behavior in relationship to telemedicine, and get people more comfortable with it, because now, in a situation where people are being forced to use it because they don't want to go out, they can't, there's no other choice, right? And maybe now it's like, oh, hey, this worked. This was easy, convenient, covered by my insurance, which a lot of people don't know is often the case, actually. Now people might be a lot more inclined towards just using telemedicine, which might really pave the way towards, what is virtual primary care, right? So, which is what, companies like Doctor on Demand are really driving forward, this concept of your primary care doc is a virtual medicine provider. And it'll be the same person on the phone every time that you FaceTime with or have a session with, but it's all virtual, and you'll never go see a primary care doctor in person. And that seems very logical, that it could very well start to happen, especially since now there are these federal mandates like to cover telemedicine, make sure it is free for people. It's going to be hard to rip that out, actually, in a few months, to just say, okay, now COVID's not a concern, but now we're going to change how these things are covered. It's going to be sticky there. So I think it'll really pave the way for telehealth. And I think, going to an earlier question, healthcare, digital health innovators should really think hard about that shifting landscape and how their solution can play a part in that.
Yeah, absolutely. I mean, it's again, nobody it's terrible that this crisis is happening. I mean, it's just absolutely horrific what we're experiencing. And I think it's going to get worse before it gets better. But there's, like most crises, there can be silver linings. And I think this is one of those silver linings in the situation. And so I think that it's going to be a game changer for us in so many different ways. Yeah. So, as a digital health innovator, what's on your mind right now? So we talked about, some of the questions of stepping back and kind of trying to figure out what's going to happen 6 to 8 weeks. But, what are some of the questions and challenges that you're facing right now?
Yeah, I think probably the biggest one is around fundraising. It's on everyone's mind. How is this going to affect being able to raise capital effectively? I think, we're seeing some hurdles in that regard, but at the same time, I think the opportunities are still there. What funds are really concerned about looking for, like, funds still have the capital, they can still deploy them, or deploy capital, but what they're super concerned about or thinking hard about and want really crystal clear answers towards or for, in order to be comfortable around making an investment, is if things are bad for you right now, how are you going to survive this? And how are you going to, what is the world going to look like in 3 months, and how are you going to still grow as a company? It's a really hard question to answer if you are in a difficult position. But it is answerable, right? And then even in our case, it's okay, if this is a tailwind for you, how how are you going to kind of bring it back to your core? How are you going to, if this is an extension of your core product, how are you going to make sure that, you aren't just a short-lived while useful solution for COVID? How are you going to continue growing thereafter? And those are fair questions, right? So I think that's where a lot of the challenges are right now, and they're just new questions that we have to address. There's always a million questions you have to address when you're raising money, but this kind of adds a new spin to it.
So I was reading an article the other day, and it was kind of like what's happening with investors in healthcare and healthcare innovation, obviously. And I came across this term that I thought was really interesting, and it said that one of the things that investors are looking for is they want to know, is your business COVID proof? And I mean, I think that there's probably no guarantees, right? By any means. But at the same time, I thought, wow, they're kind of giving us insights into what they're looking for. And so if I'm creating or helping a client create their pitch deck, whatever they were pitching before, that deck needs to be revised, right?
At least a slide, probably. At least right? It needs to be addressed.
Yeah. And what better way to grab their attention and hold their attention of, being able to present that you've got a COVID-proof business and here's why and how. What do you think about that?
No, I think it's spot on, right? I think it's kind of a briefer, more succinct way of describing what I was mentioning before of like kind of what funds are looking for, really, whether it is a tailwind or a headwind, they want to know that you're COVID proof.
Yep, exactly. So this has been absolutely fantastic. I look to see you on more covers of more business magazines and healthcare media. I mean, I think that you have an incredible story, and I think beyond all the business stuff that we've talked about here, the real opportunity, and I think what's so exciting is that all of us, I think, go into business because we want to make money, but most of us go into business because we want to change the world. We want to be able to make a difference in some kind of way. And what better opportunity to leave your thumbprint, your fingerprint on the world by being able to say, like you started with this conversation, we helped in some small way. We made a difference through the COVID crisis. That's really exciting.
Yeah, absolutely. And I think we feel very grateful that we are in a position to feel like, to not feel helpless and feel like, we just have to kind of sit on our hands and wait for this to flow through. Like, I think a lot of people are feeling right now, like we feel very grateful that we're even in a position to be able to deliver something that is helpful right now. And I want to kind of give credit to my team. Like the team has been putting in a ton of hours, working really, really hard to make this all a reality. And so, that's another thing as a message to just other innovators, right? The absolute best thing you can do, if nothing else right now, is focus on your team and team building. And because the only reason we've been able to weather the storm right now is because we had put in so much time and effort and thoughtfulness leading up to this point, and making sure that we have the right and the best people working together on Clearstep, and now it's great to kind of be able to fall back on that.
Yeah, absolutely. And I mean, with so many millions of people out of work right now, again, kind of that other contribution is being able to serve the industry and the community, but, being able to pivot well around this crisis, and be able to, no matter how big the team is, to be able to create sustainability financially for the team is incredibly rewarding.
Yeah, absolutely.
Yeah.
Absolutely.
Well, thank you so much for your time today. It's been a great conversation. I've definitely enjoyed it. Before we wrap up, can you just give our listeners a way to be able to get a hold of you, just in case anybody has questions?
Yeah, absolutely. Easiest way is to just go online, go on our website, clearstep.health. If you fill out a form submission there, and if you reference me, it'll make its way over to me, and happy to get in touch with anyone who's interested in talking more, whether you're a fellow entrepreneur or a health system or a hospital that's looking for this kind of care routing solution. Happy to engage, and thank you so much for having me on.
Thank you. Bye.
Awesome. Bye.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and your attention. To save time and get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who's been sharing the show with friends and colleagues. See you on the next episode of COIQ.